You might remember last week we had an update about those popular weight loss and diabetes injections so many people are using. Well, a study finds that they helped lower the risk of heart disease by 20%. Well, now there is a new finding, and as medical reporter Meg Ferris tells us, doctors say this precaution could be life-saving.
Hear it click initially.
Semaglutide is the game-changing weight loss and diabetes medication, helping patients lose and keep weight off more easily. The compounded versions make it more affordable and accessible. So now, with more people using it, doctors are finding a new issue when patients need anesthesia.
We want to prevent something called aspiration. And aspiration is when the food or water or stomach contents can come up and go into your lungs, and that can ultimately cause damage to your lungs and infection, which could make you really sick.
Surgeons like Tulane's Dr. Shauna Levy want your stomach empty when you are sedated. That's why they tell you to stop eating or drinking anything the night before a procedure.
But this drug is supposed to make the contents of your stomach empty more slowly.
That's right. And so what that means is if food that you might have eaten a day or two or several days ago might still be in your stomach at time of surgery.
ER physician Dr. May Scott has more than 1,000 patients on semaglutide at Kronos and says he's telling patients to take precautions before both general anesthesia or a lighter sedation.
This is something you always want to talk over with the physician who is doing the procedure long before you do the procedure.
And a digestive system that's not empty could interfere with a GI screening procedure like a colonoscopy.
It's important to make sure that your GI doc knows that you're on these medicines, because the preps may not work as well. You really want to get off of this medicine, like I said, at least a week, if not longer, before doing a procedure like that.
From what I've seen from the American Society of Anesthesiologists, it is still 1 week. But I think what's very clear is that we don't know. And so that's why anesthesiologists want you to stop the medication even earlier than we originally thought.
Some doctors will want to do an ultrasound before surgery to make sure your stomach is empty, but they'll all agree communication is key.
So if you have surgery in the next 2 to 3 weeks and you're on one of these medicines, semaglutide, please make sure that you talk to your doctor.
Meg Ferris, Eyewitness News, Medical Watch.
Well, since this complication can be life-threatening before a procedure, you should not only talk to the surgeon about your medications, but to the anesthesiologist as well.